Welcome to Anatomy 02. This is going to be our second lecture in this fundamental or basic introduction to anatomy that's going to carry you through your degree. Today we're going to follow on from our introductory lecture that we did last week. Last week we talked about the anatomical position. We talked about the planes that divide up the body. We talked about the terms that describe where parts of the body are in relation to each other, and we did a big overview, an introduction to the skeleton itself. So if you haven't caught up on that material, I suggest you do that now. Make sure that you've covered that before you move on to this new material here today. Today we are going to look at the skeleton in a little bit more detail. Specifically, we're going to focus in on the axial and appendicular skeleton and how they are differentiated. So let's get straight into it. The axial skeleton consists primarily of the skull, the vertebral column, the ribs, and the sternum. If we're speaking strictly, it also includes the auditory bones, they're the ones in the ear, and the hyoid bone, which is a sesamoid bone located in your neck. The appendicular skeleton consists of the bones of the upper and lower limbs, so that's the bones of your arms and your legs, the girdles that connect them to the axial skeleton, so these are your pectoral girdle and your pelvic girdle, or your shoulder and your hips. Okay, so the differentiation between your axial and your appendicular skeleton. Your axial skeleton, think about it like an axis down the middle of your body. It is the central column of the spine from which your arms and your legs are supported. The appendicular skeleton includes the bones of your arms, your legs, your hands, your feet, and it also includes the bones that join those arms and legs onto your axial skeleton. So they are the bones of your shoulder girdle, and your hip, your pelvic girdle. I'm going to switch over to my skeleton. There we go, you guys can see him there now, and flip this guy over here. So double check you can see the skeleton. Yes, you can. Right, so back to our skeleton here. So let's have a look. We're going to start by looking at the bones of the axial skeleton. So the first bone of the axial skeleton is your skull. Now, we sometimes think of the skull as one big bone there that protects your brain, supports makes up our head and our face. But what it's important to realize is that the skull is actually comprised of 22 different bones. There's 8 cranial bones and there's 14 facial bones. So if we zoom in on the head here, what you can see is that there are all these what look like cracks all around the bones of the skull there, and that's just where the different bones are. Bring them back over there. That's just where the different bones meet and join up. So these bones are joined together in such a way that there's no movement allowed, and essentially the skull is one solid unit, one solid bone. But it is important to know that there are many individual bones that make up the skull. Now, I don't expect you to remember all 22 individual bones, but I will show you some of the different bones here. One at the front here, if we highlight that guy, there we go, we have the frontal bone. So highlighted nicely in green there. The frontal bone is basically the bone that forms the front of your skull, your forehead, and it is a large flat bone. That's the type of bone that we mentioned last week. If we spin around to the side here, we can see these joins, these sutures that are located all the way around that differentiate where the different bones are from each other. If we take this next big one on top here, we've got the parietal bone, another bone of the skull. We have a parietal bone that is on the left and the right side. So if we look down from the top here, we can see that we have our frontal bone at the front, and then we've got the parietal bone on the left, and we've got the parietal bone on the right there. So they make up the top and the upper portion of the back of your skull there. At the side here, we have your temporal bone. Okay, this temporal bone here is actually an irregular bone. The other ones we looked at there were flat bones. This is an irregular bone. It is located on the side of your head, roughly around about where your ear is, and it forms a joint with your mandible. That's your jawbone, another a bone that's part of your face there, not part of the skull, but part of the face. So where your temporal bone meets your mandible, we've got the Temporomandibular Joints. It's the fancy name for the joint where the place where your jaw pivots against your skull here. So that's just named because we've got your temporal bone, we've got your mandible, your Temporomandibular Joint. At the back then, the last big bone of the skull that I'm going to point out to you here is called your occipital bone. So that's a large bone at the base of your skull around the back here. It's a flat bone, and when we start to look at the muscles, we will see that there's a number of muscles involved in support and movement that are attached onto your occipital bone there at the back. So they're just the big bones of your skull. We've got the frontal bone, the parietal bone, the occipital bone, and the temporal bone and the occipital bone. If we look into the face, we've got the mandible, that's your lower jawbone there. And then, I'm not going to go into it, but you've got loads of different bones in around your face. So in your nose, you've got your nasal bones. In the upper part of your jaw, you've got your maxilla. And then you've got the bones that make up your cheeks, your zygomatic bone. Now again, like I said, I don't expect you to remember all of these bones in your face. I'm just showing you for interest's sake. The bones of the skull, it's good to know them. The mandible there, that's an important bone that you should know about. And one that we mentioned earlier there is your hyoid bone. So your hyoid bone there is this little sesamoid bone. So it's located in some cartilage there. If I put the digestive respiratory system on, so what we're looking at there, we see the hyoid bone sits on top of your trachea, on top of your windpipe there. So that's the pipe that brings air down into your lungs. We can see it going down into the lungs there. And your hyoid bone is a bone that sits on top of that, providing some support, stability, and some structure to the top of your windpipe, or to the top of your trachea there. So when we see it in isolation, if we take the respiratory system out, it looks like it's just floating there on its own, but it actually sits in on top of your windpipe. Okay, so what we're looking at the bones of the axial skeleton. So we've seen the skull. The skull sits atop of the axial skeleton there, and we've had a look at some of the different bones that are located in it. Next, we've got the bones of the vertebral column. This is again part of your axial skeleton. And if we zoom out there, your vertebral column is this big, long series of bones here that make up your spine. Okay, each individual bone is known as a vertebra, and there are different sections in your vertebrae. So you've got the individual vertebrae that make up your neck. They're called your cervical vertebrae. You've got the individual vertebrae that make up and support your thorax, your thoracic vertebrae, and we've got the ones that are in your lower back, your lumbar vertebrae down below. Up in the neck, we've got 7 cervical vertebrae, and they're just called C1 to C7. Next, we've got 12 thoracic vertebrae. They're named T1 to T12. And then below that, we've got 5 lumbar vertebrae, L1 to L5. So 3 zones: cervical, thoracic, and lumbar. 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. In the part of the axial skeleton there is we also include the rib cage. So we can see here the ribs that form the rib cage there. We've got 12 pairs of ribs, and each one of those, or each pair of those ribs, is supported by one of the thoracic vertebrae. We said we've got 12 thoracic vertebrae, T1 through to T12. So there's T1, first thoracic vertebrae at the top, and we see that off that we've got our first pair of ribs, and that pattern is continued all the way down until we go down to T12, which is this one down here, the 12th thoracic vertebrae, and we've got our last rib off that. So we've got 12 thoracic vertebrae and we've got 12 ribs that are attached onto those thoracic vertebrae at the back. The first 7 ribs are attached directly onto our sternum. So we can't see it there. Here's our sternum, our breastbone at the front. If we add in our connective tissue, we see that there's connective tissue connecting the ends of the ribs to the sternum here. So the first 7 ribs, 1, 2, 3, 4, 5, 6 and 7, have a direct connection onto the sternum. So you see there we've got a direct connection for each of those ribs onto the sternum. The remaining 5 ribs that are located below that don't have a direct connection onto the sternum, and they are sometimes called your floating ribs. So they're connected either not at all, in the case of these ones down here, or indirectly via some connective tissue onto the rib cage there. So the first 7 are connected directly to the sternum. The next 5 pairs are known as false or floating ribs because they are connected indirectly to it. So I'm jumping back a little bit now to the spinal cord here. So we said we've got 3 main sections. We've got the cervical vertebrae, 7 cervical vertebrae that make up the neck. We've got those 12 thoracic vertebrae that make up your chest and your rib cage, or support your chest and your rib cage. And we've got your lumbar vertebrae down at the bottom here, which make up your lower back. If we go just below that, we see we've got a little bit more structure to our spinal column. We have got our sacrum, which is down at the bottom here, and we've got our coccyx, which is down at the very bottom down here. So we've got they're the last bones that make up your vertebral column. In the sacrum, we've actually got 5 individual bones that are fused together to form this one structure, and in this coccyx we've got 4 bones that are fused together, but they're just often considered, even though there's 9 individual bones down here, they're often considered 2 because that's how they're fused together. 5 bones fused together to form the sacrum, 4 bones fused together to form the coccyx. So that is all of the bones that are in your axial skeleton. So if we zoom back out there, we said, looks a bit odd there with some of the connective tissue added in. We'll go back to just the skeleton. So the axial skeleton consists of the bones of the skull and the head, the bones of the vertebral column all the way down to the coccyx, the rib cage and the sternum at the front. And strictly speaking, it also includes the hyoid bone in the neck, and it also includes the tiny little bones that are in your inner ear. So that's your axial skeleton, that central core of the skeleton there, off which your arms and your legs are supported. So we'll move on and have a look at your appendicular skeleton now in a little bit more detail. So we'll start at the top, and we will look at your shoulder girdle first. So we said the appendicular skeleton consists of your arms and your legs and the bones that attach those your limbs onto your axial skeleton. So if we were to zoom in here and look at our shoulder girdle consists of 2 bones. We've got our scapula, which is our shoulder bone or shoulder blade at the back, and we've got our collarbone at the front here. So there's our collarbone and our shoulder. So those two bones together form the shoulder girdle. We've got one girdle on each side. So we'll join these guys in, our other scapula and our other clavicle. So two collarbones, the two clavicles, two scapula, your two shoulder blades, form your two shoulder girdles. And if we look, we've kind of got an incomplete ring going around the body here. Okay, so they join. If I spin them around to the front here, kind of hard to see with the skull there, but we've almost got this ring of bone surrounding the body. There's connective tissue here at the front, almost joining those two on together, and at the back we've got a lot of muscle attaching the scapula onto the ribs in the vertebrae in the middle here. But the bony structures are the two clavicles and the two scapula there, forming two shoulder girdles. Okay. Those shoulder girdles support our arms. So our arm, the shoulder joint, is formed where our humerus, so our upper arm, joins the shoulder girdle, creating the shoulder joint. So if we zoom in here, what we're looking at in this area here is the shoulder joint. We've got the shoulder girdle supporting the humerus of the upper arm. This is our shoulder joint. So I just want to exit that selection. Okay, so there are the bones of the shoulder girdle. Your scapula, shoulder blade, and your clavicle, your collarbone there. Moving down into the arm, we'll look at the bones, the main bones of the upper arm. So we've got the humerus. We've mentioned that already. This is a long bone in the upper arm, your humerus. Below the humerus, or distal to the humerus, so further from the main part of the body, further from the trunk of the body, we've got two long bones in your forearm. They are your radius and your ulna. So there we have them highlighted there, your radius and your ulna. So we've got one long bone in your upper arm, your humerus, and we've got two long bones in your forearm, your radius and your ulna. We've got the bones of your wrist. We mentioned these last week. There's a whole load of little bones there. We're not going to go into them individually. Together, they are known as your carpal bones. So the bones of your wrist are your carpal bones. We have one selected there, okay, your carpal bones. So there's a load of short bones there. Together, grouped together, they are the bones of your wrist. Moving further distal, so distal to the bones of your wrist, we've got the bones of your hands. So these are long bones again, and these bones are called your metacarpals. So the carpals form the wrist, and the metacarpals form the hands. Finally, distal to them, we have your phalanges. That's the proper name for the bones of your fingers. Okay, so the wrists are your carpals, your hands bones are your metacarpals, and the bones of your fingers are known as your phalanges. So they are the bones that make up your shoulder girdle and your arm. We've got your clavicle and scapula, your shoulder girdle. We've got the humerus, which meets the clavicle and the scapula at your shoulder joints. Distal to the humerus, we have your radius and ulna. They form the bones of your forearm. Distal to your radius and ulna, we've got the bones of your wrist. They are known as your carpals. Distal to your carpals, we have the bones of your hands. They are known as your metacarpals. And finally, distal to your metacarpals, we have the bones of your fingers, known as your phalanges. Okay, I'm going to move straight on, and we're going to talk about the pelvic girdle, the hip girdle, and the bones of the lower leg. I think I might start with the bones of the lower leg first, because there's a pattern to what's going on here, which might make it easier for you to remember. So we said your arm, we've got one long bone, two short bones, the bones of the wrist, the bones of the hand, the bones of the fingers. In our lower limb, we've got the same pattern. We've got one long bone in your thigh, we've got two long bones in your shin, your lower leg, then we've got the bones of the ankle, the bones of the foot, and the bones of the fingers. So they're named pretty similarly. The long bone in your thigh is known as your femur. In your leg, we've got your tibia and we've got your fibula. They're the two long bones in your shin. If we zoom into your ankle, we've got the bones of your ankle. We said you've got your carpals are the bones of your wrist. In your foot, you have your tarsals, which are the bones of your ankle. Then we have the bones of your foot, which are your metatarsals. In your hand, we had the carpals and the metacarpals. In your foot, we've got the tarsals and the metatarsals. And then finally, the bones of your toes are also known as your phalanges. Okay, so that's how I like to remember it. Think of toes, tarsals, metatarsals, all the T's. Up in your hands, you've got your carpals, your metacarpals, and your phalanges. The last thing that we need to discuss then is your hip girdle. Okay, how is your pelvic girdle? How your leg is attached onto your axial skeleton. So that's the last thing that we'll cover now. Your pelvis or your hip, like so many of the other bones we've discussed, is actually many bones fused together. So we've got two hip bones. If we look there, we see that our hip bones are made up of three individual bones. So if we look at either side, we've got the ilium, we've got the pubis, and we've got the ischium. So the three bones that we've highlighted there together make up one side of your pelvic girdle. Your ilium, your ischium, and your pubis. Again, they're fused together, but they are considered to be three distinct separate bones. So we look at them individually there. We've got this big, large, flat bone at the top, your ilium. Okay, then underneath your ilium, we have got your ischium, an irregular bone. And towards the front, we've got your pubis, again, another irregular bone. So the ilium, the ischium, and the pubis form one side of the pelvic girdle. Then obviously, if we select all of those again, we've got the ilium, the ischium, and the pubis. The ilium, ischium, and the pubis. We see here we've got a similar situation as we had up in the shoulder. We've got this ring of bone, this girdle that wraps around, when we look at it, our pelvic girdle, that joins onto our axial skeleton at the sacrum. So if we select in the sacrum there, now we've got this pretty much complete ring of bone all the way around here. So our appendicular skeleton, our hip and our leg, is joined on to the axial skeleton here at the via the pelvic girdle. Specifically, what we've got here, if I exit this selection, see if I can select it there. We've got where these two bones meet, where the ilium and the sacrum meet, we've got the sacroiliac joint. So that is the joint where your sacrum, this bone at the base of your spine, meets your ilium, which is part of your pelvis there, part of your hip bone, and that's where they join together. Okay, so that is a very quick introduction to all of the major bones of the body that you are going to need to know. Everything we've covered today is need to know, so you should familiarize yourself with all of it. What we have gone through is the axial skeleton and the bones that comprise the axial skeleton, and the appendicular skeleton, the bones that comprise the appendicular skeleton. The bones of the arms and hand and foot. The bones of the arm, upper arm, lower arm, wrist, and hands and the bones of the upper leg, lower leg, ankle and foot. Remember, there's a pattern to how they're structured. One long bone, two long bones, a series of short bones, long bones of the hand and foot, and your phalanges. Remember that pattern. It just makes it a little bit easier to understand rather than looking back and saying, oh my god, there's so many individual things that I need to remember here. But it is important that you guys get to grips with this, because it will carry you through so many of your future modules, and you will come back to this knowledge over and over again throughout your career. So it's good to try and commit it to memory now. So that's it covered, axial and appendicular skeleton. As always, if you guys have any questions, you can catch me on Teams. Please ask any questions that you want there. Okay, we'll park it there for today. I'll see you in the next class. Thank you.